introduction. So, viewers, listeners, we all know that there is actually no treatment currently for COVID-19. There is no drug that we are sure that can treat COVID-19. At the moment, we are using mostly symptomatic treatment, which means that we treat the symptoms that patients come with. We know the symptoms of COVID. Some people get fevers, cough, chest pain, difficulty breathing. Some of them can't taste, they can't smell, they have aches and pains in the body. But a large portion of people also have no symptoms at all. That means they're asymptomatic. So what is happening now in the hospitals is the patients are being treated according to the symptoms they come with. If they have pain, if they have fever, we control the fever with drugs that take down the temperature, like diclofenac or paracetamol. We give painkillers, and we also give some vitamins that might help boost the immunity and help the body fight better. These are like vitamin C tablets. We may give zinc, which helps also the body repair itself. Now the body is the one that fights the virus. We just give treatment to support the body to do its work. Now, most of our patients here in Uganda have had mild disease. There was a press release recently by Makerere University, led by Bruce Chirenga and colleagues. They had a press release where they talked about the patients who we've had in Uganda at the time. Numbers have gone up since then. But they described to us that most of the patients were young, so the average age was about 33 years, and not many of them had severe disease. Actually, only about 2 or 3 patients had required oxygen. So most of the patients we have had in Uganda have been either with no symptoms, asymptomatic, or mild symptoms like cough and fever. So the patients have received that symptomatic care for treatment of their symptoms. Now, while we are treating the patients just for symptoms, we know that there's a lot of research that is ongoing outside Uganda, and hopefully we will also, and even in Uganda, there is research starting. And we also plan to also test drugs which we think can work here in Uganda. So we're waiting for research to be completed to tell us about vaccines and about the drugs. Why are we so successful so far with less deaths? There could be many reasons, but I'll list a few. One is we implemented the social distancing guidelines very early in the wave of the disease in the world. So we had social distancing guidelines implemented even before we got a case. And that bought us a lot of time and took us a long way in preventing rapid spread and community spread, which is what we're trying to prevent now. Yes, we are blessed to have mild disease. Could be because our population is mostly young. We know that those who are older are more likely to have severe disease. And with our young population, they're more likely to get mild disease. But also, we have less people who have what we call comorbidities. In the West, in the US, in Europe, we have a lot of people who are very obese, who have severe hypertension, high blood pressure, diabetes, heart disease. All these make you more likely to have severe COVID. Now we have less of that population. In the people that we have had here in Uganda, we have had about maybe 10% who had these kind of diseases. So unlike in the West where they're older and they have a lot of other diseases that make you have a high risk. So these could have contributed to the success. All our patients who are infected with COVID are under quarantine. In other countries, patients who have mild disease are left to stay at home, and only those with severe disease have gone into hospitals. So why do we need to keep social distancing guidelines? because we need to have numbers that are low enough to keep those who are infected in hospital. If we allow everybody to move around as they wish and not wear masks and not wash their hands, we'll have a lot of community spread. And what will happen when there's a community spread? The proportion of people who have severe disease will most likely go up because we'll take it home to our grandparents and to the older people who are in the community. So we'll have a lot of people who have a high risk of getting severe disease. We won't just have the 2 or 3 that we had before. Then the hospitals will get full. And we don't know if our health system can support the numbers that have been reported in the US, in Italy, in Spain. So we want to continue with our social distancing guidelines so that we limit community spread and can continue to manage the few cases that we're getting in our hospitals. I think that is a summary of what I would like to say for now.